everyone. Welcome to another episode of the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Navin Gupta, the CEO at iN2L plus LifeLoop. How are you today?
Thank you, Jared. Thank you for having me.
I'm really excited for us to chat. Let's dive right into it. We like to keep these short and sweet. Tell me a little bit about your background, and then we'll talk about the company.
Yeah, sort of my career arc has been an intersection of technology, healthcare, and innovation. Although I didn't start out in healthcare, I got to really see the benefits of using technology at scale to improve human lives, both in telecommunication and subsequently in healthcare as well. I started out in post-acute care with Philips Healthcare and really was innovating around helping nurses within ICUs with patient monitoring and alarm solutions, and then subsequently into post-acute care, both in senior living, skilled nursing, CCRC, and then last with home health and hospice.
And talk us through the kind of evolution. So you gave us a great overview of kind of how your career started. You're the CEO of iN2L plus LifeLoop. Talk us through kind of how that came to be and really what you like about the company.
Yeah, I think once I transitioned into post-acute care and got involved in senior care in particular, and just saw how broken and how fractured the entire senior aging experience was, got to see end-of-life care and hospice. As I was looking to transition out of resident matrix care, where we were touching millions of lives through our solutions, um, iN2L and LifeLoop felt like it was a bit of a continuation of my personal passion of being able to drive human flourishing, and in this case, specifically tied to senior care. iN2L and LifeLoop both are very, very mission minded, and both of them are in the senior living space using technology to improve the life of residents, family, and staff. So to me, it just felt like the journey that I've been for over the last decade, that iN2L and LifeLoop allowed me to continue that passion for senior care.
Now, when it comes to the senior living industry, Naveen, uh, I hear a lot of chatter that the industry is ripe for change right now. Why is that?
Yeah, Jared, I think there's a trifecta effect, right? First, there is a rapidly aging population, right? So 10,000, you hear the stats of 10,000, really becoming eligible for Medicare, almost doubling of the senior population within the next decade or so. So you've got that going on. Certainly, there is a lack of caregiver or the need for more caregivers in the space. And the third is just this exponential growth in cost for healthcare delivery. And with all of that, there is this opportunity to bend the cost curve by focusing on preventative care, a space which iN2L and LifeLoop are actively engaged in. Seniors are much more proficient when it comes to technology. There's a deep need for them to be engaged both cognitively, and socially, emotionally. And there's a number of technology solutions, Jared, that are beginning to emerge, from telehealth to smart home to care coordination platforms. And the space that iN2L and LifeLoop plays in with regards to communication, engagement, and workforce solutions, that these are becoming increasingly important within the senior living space.
And you mentioned in this industry, right? The parts that are ripe for innovation. What is it in particular that you like? So there's a lot of things that you probably like in terms of the space because of that it's ripe for innovation. But can you also tell us just in general what you like about the senior care living space?
Yeah, I think first off, right, I think there's huge tailwinds in terms of the number of seniors that will need care. A lot of care will be delivered in home and community-based settings, but there's a lot of care that will be delivered within traditional sort of senior living space as well. And so the opportunity and expectations are much, much higher for seniors that are beginning to age, right? They're looking for meaningful connections. This is not their sort of their final chapter for them. They're looking to add many more chapters, and having solutions and technology that enable to remove the friction that's there, enable to have deep connectivity, both within the organizations that they're a part of, and communities that they're a part of, but also with the sort of the families and loved ones. Uh, they are pretty much in every workflow that you see today in the current state. The ability to meaningfully change that is going to be really important here.
Now, as it relates to this space that you're in, why is it so imperative that we are integrating technology to improve this industry? I know every industry has their, their spiel on why we should be innovating within it, but I think you're in such an interesting space because um because we have so many seniors, right? The population is definitely changing. Can you talk through why it's so important to integrate technology into this space?
Yeah, Jared, I think the number one driver really is the shortage of staff, right? And the ability to meaningfully care for seniors, right? So across the board, we've seen burnout. There is this great resignation there. There's greater demand for infection controls. Caretakers, particularly within these care settings, are being stretched incredibly. So with that, there is no room for waste when you have disparate systems within within the senior living communities. You've got payroll solutions, you've got revenue cycle management solutions, you've got clinical solutions, you've got marketing solutions, you've got transportation solutions and maintenance. There's tons of solutions, dining solutions that are the engagement solutions like hours and communication. All of these systems, they're not talking to each other. What that means for caregivers and staff is that they're inputting and entering information over and over again into multiple places. Second, they don't have a comprehensive view of the senior that is within their community. And so this, what I call it, is basically the fragmentation of data across the community that prevents operators from truly understanding and personalizing the needs of the seniors and being able to effectively care for them. There is no option but to use technology to be able to scale and create a labor multiplier here.
So let's dive more into that piece because I actually come from one of my first jobs out of college is I was in the healthcare staffing space, but primarily uh, hospital medicine, anesthesia. This is a really interesting space when I look at it from the staffing perspective, given the shortages like a lot of healthcare is facing. So you talked about technology and you gave us a little bit around how it can help with these staffing shortages. Can you continue to elaborate on that because I find that piece so interesting.
Yeah, it's funny, Jared. Prior I was with Electronic Health Record Solutions. It was a similar issue, right? And you can classify things around even taking the top three most common workflows, right, and saying you're going to cut that time by 50%, right? Could be one way by just using improved workflow analytics and implementation of improvements there. Second is using automation, right? I think there's a number of solutions that are available. Common repetitive tasks that are there can be automated and should be automated so that staff are not repeating that information. The third is rich interoperability, Jared, right? The ability for systems to talk to each other and not just exchange information, but exchange information in a format where the systems can consume that. Fourth is being able to upskill, right, and give opportunities for staff to be able to do more through the use of technology. These are all different ways that we can do to try and alleviate some of the problems and challenges that staff are facing on a day-to-day basis.
It's so incredible to see how far the space has come over the last couple of years, and that's just not limited to um, the space that we're in. Just healthcare in general. It's been really interesting to see how things have evolved. Uh, what I would like to kind of dive a little bit more into outside of the staffing space in the senior living industry and just to community. What are you really excited about in terms of the other innovations that are happening within this space?
Yeah, I think I was chatting with a wellness director recently, and in South Florida, and and she made a statement that has really stuck with me. She said, "Loneliness has killed more seniors than COVID," right? And her point was, as part of the aging experience, we've got to continue to drive innovation around the whole being, right, of the senior. Not only just, if there is an episode that they have where they go to the hospital and receive care and come back. We've got to focus on building connections, developing healthy habits, and improving lifestyle that's there. So the tools and solutions that iN2L and LifeLoop currently are focused on, and that's one aspect of it certainly, is being able to find personalized content that allows them to be engaged within the community, and the loved ones, the family members, have insights into what's really going on with that. And second is being able to create these workflows that we've been referring to, right? Wherever there's friction in the system, whether it is ability for a resident or a family member to communicate with the executive director, or to communicate with dining, or to be able to share videos or pictures or images so that they can have meaningful, rich connections, or even simple things that we take for granted, Jared, of being able to do video chat and all of that, making that available in a single, integrated, easy to use enterprise solution format is what communities are really asking for. And then the second part of it, Jared, what I'll say is analytics, right? So we talk a little bit about predictive analytics and AI and ML, right? It'll be great to understand if there is a cognitive decline, right, for a senior, and they're likely going to need a care and should be transitioning from AL to memory care, or how are they progressing towards potentially dementia or Alzheimer, right? So the innovation around modeling what future care needs for seniors will be through the use of insights that we have through the platforms that are deployed are two broad areas that really sort of resonate with me. And I think there's a lot of work to be done there.
Yeah, it's really interesting to think through. It would be incredible to be able to predict who's going to have, enter into advanced stages
Yeah,
of Alzheimer's, and not just for the ability to potentially help them sooner, right? But also to, like you're talking about, model their care, their long-term care much more differently.
absolutely, absolutely. Service plans, care plans. And the other thing, Jared, think about it. Not every senior needs the exact same level of care. When you have a staffing shortage, being able to direct staff to where the needs are based on insights and analytics that are available are definitely one of the ways to be able to scale sort of the staffing issue.
It was funny, Naveen, when I was doing research on just the healthcare staffing space, just broadly,
Yeah,
globally, a few years ago. I was looking at this like stat just around, this was just a generic stat that around like 2030 we were going to be short like 15 million healthcare workers globally. And it was really interesting when I looked at how it was structured. It was really based on an aging population and maldistribution. Like we weren't distributing caregivers to where they actually needed to be. So what you're talking about, um, helping to better understand the long-term care for the elderly population, and then having that analytics would also help on the other areas, right? Knowing which areas of the country to maybe staff up more, which care centers to staff up more. So it was really really interesting to hear your thoughts on where we need to innovate and where we're heading. So thank you for sharing that.
yeah, sure. I think the same goes. Even you talk about geographically, but even within home health visits, right? So typically within home health agencies, as caregivers are being scheduled, scheduling based on higher acuity, or within skilled nursing facilities, scheduling based on higher acuity, even within senior living or memory care, right? Being able to tailor that are all things we should be thinking about.
Absolutely. My last question for you, Naveen, is you already talked a little bit about some of the exciting developments, but what's next for you and the company?
Yeah, I think iN2L and LifeLoop came together about 6 months ago. Leading Age, we launched this first enterprise grade, first within the senior living industry of engagement and, and workflow efficiency tools, staffing efficiency tools integrated in a single platform, allowing both staff, family, and residents to be able to use any device of choice and to be able to take advantage of personalized content that enables them to age effectively, age efficiently, and have meaningful, rich, deep connections within the community and outside the community. So, very, very excited about in such short order that innovation bringing that to market.
Yeah, I'm super excited for you and the team. We'll have to have you come back on. We do like panels where we can do like a senior care panel and we can have some other people from the industry and we can all kind of talk back and forth about the future of this industry and where it's heading. So really appreciate you coming on the podcast today.
Thank you, Jared. Really appreciate it.